everyone, this video is about Ryle's tube or NG tube. The typical length of a Ryle's tube is about 120 to 125 centimeters. It has exactly 4 markings which indicate where the Ryle's tube is. So when it has been inserted up to the level of cardia, outside you will see a marking of 40 centimeters. At a 50 centimeter marking, it means that the Ryle's tube has been inserted up to the level of body of stomach. At 60 centimeters, it means that the Ryle's tube has been inserted up to pylorus, and 70 centimeters means duodenum. Now, for the measurement of a Ryle's tube, the method that we use is an NEX method, which means nose, ear, and xiphisternum. What we do is, we take the exit port at the tip of the nose of the Ryle's tube. So the exit port of the Ryle's tube is taken at the tip of the nose. From there, it is taken up to the earlobe, and from there up to the xiphisternum of the person. So that is how you measure a Ryle's tube, by using the NEX method: nose, earlobe, and xiphisternum. The position of insertion has to be sitting with neck flexed. That means the patient has to be in sitting position with neck flexed. Now let us look at the steps of insertion of the NG tube. You have to lubricate the tube using 10 ml of 1% lignocaine gel, and then pass the tube from the floor of the nasal passage. So you pass it through the nose, but from the floor area of the nasal passage. So when the tube reaches up to the pharynx, the patient is asked to drink water and swallow while advancing the tube. Keep advancing the tube inwards, and along with that, ask the patient to drink water and swallow. Pass the tube up to the marked length, and when the tube reaches the marked length, check the position. Check whether the tube is in the correct position or not, and then finally secure the tube with a tape. Now, how do we confirm whether the tube is in the correct position or not? First method is by auscultation. Auscultation is done in the epigastric area. So you take a syringe and you inject plain air through that syringe, nothing else, just air. When you keep a stethoscope on the epigastric area, a gush of air will be heard as you do this, because air will enter the stomach through the syringe. Apart from that, a chest X-ray can also be used to confirm the position, and also by aspiration of the gastric contents. An NG tube is indicated when the patient has to be kept nil per oral for some medical or surgical reason. For example, in appendicitis, in severe appendicitis, in intestinal obstructions, in portal varices, keeping the patient on NPO is indicated. That is when we use NG tube for feeding the patient. Also, an NG tube is used when you have to aspirate gastric fluid. You can put the NG tube and use it to aspirate the contents of the stomach. Apart from that, in Zollinger-Ellison syndrome, an NG tube is inserted in gastric decompression and during bowel irrigation. To perform bowel irrigation, it is done through an NG tube. Contraindications of insertion of NG tube include base of skull fractures. If there is any fracture in the base or involving the base of the skull, an NG tube has to not be inserted. Also, in case of severe midfacial traumas and nasal surgery which has happened recently, you should not insert an NG tube in these cases.